On today's podcast, we're looking to improve the healthcare system. And guess what? We're going to do it one doctor patient relationship at a time. And on today's podcast, we have a rock star OD that has mastered this, that understands the importance of direct care. On today's podcast, we're hanging out with the one and only Dr. Kara Foster. Let's go. This is a Defocus Media production.
Audio Jungle.
What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus. What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover. I'm back in action. Super excited today because we're talking about saving the healthcare system.
Yes.
And as eye care professionals, I always like to say that we are the gatekeepers into the healthcare system because what we do is touch many lives because we can determine so much by just looking at the eyes. We can diagnose or help aid diagnose up to 270 medical conditions. That is quite impressive if you think about it. Mm-hmm. And on today's podcast, we have the one and only Dr. Foster that's really going to put us on the game and tell us about her journey, but really kind of walk us through how we can change the healthcare system. Dr. Foster, how are you doing today, my friend?
Fantastic. I really appreciate you having me here. I'm excited to talk more about direct care because it's just awesome. And I'm happy to be able to be here and tell everybody about it. So thank you.
Well, I'm super excited to have you and even more super excited that you're a fellow North Carolinian.
Yeah.
Right? I'm in Raleigh, Durham. I think you're out in where, Apex or
yeah, I'm not too far. I'm only about 20 minutes from there. Yep, I'm in Apex.
You done this in person, my friend. I could have came up.
Done this in person.
Got it there.
Yeah, we'll have to do it again.
Well, I like to always big up North Carolina. Everyone out there listening that's looking to practice in North Carolina, this is the place to practice.
It's great.
Full scope optometry, fantastic patient base, always cutting edge technology in regards to different companies and the RTP, all the schools. It's just a fantastic place to live and practice optometry in general. And all that stuff you're saying about the boards is not true. You just got to study and life will be great. So come on down to North Carolina because we need more ODs, no doubt about it.
Yeah, no doubt.
All right, Dr. Foster. So before I get on a tangent and go off on something, let's really get to know who you are. If you don't mind, just maybe giving us an overview of your background, where you're from, where you went to school. And we always love to share a fun fact as well.
Fun fact. Okay.
Yeah.
Well, I'm originally from Western Pennsylvania. I went to school at Boston at NECO and I graduated 2009. And after that, I did not have any desire to go back to Pennsylvania. So I wanted to check out North Carolina. So I've been here ever since. So it's been about 15 years. I just love practicing here in North Carolina. Like you were saying, the patient base is great. It just is there's so much to do. I just love it here and full scope optometry too. So it's really great that the board is very supportive, great, OD, MD relationships. So I've been here for about 15 years. And then really I love eye care. I just got into eye care because I really wanted to help troubleshoot, solve people's problems, spend time, build those relationships. A lot of the reasons why we all got into it. I appreciate that eye care has a lot of independent kind of aspects. I mean, there's a lot of health professions that you can't really be as independent as you can in eye care. And I like that kind of autonomy that we have here. So I did work as an associate for about 6 years, and then I opened my own practice in 2015. And then, at the beginning, you open your own practice and you think you have to do it like everybody else. So you open your own practice to be different, which is what I was looking for. But then you start taking insurances and it's just, it just was not sustainable. So that's when I started just kind of trying to see what are my options? Is there a way for me to be able to be more sustainable and practice the way I want? Because I didn't open my practice to be working for the insurance companies. You open your own practice and you go through all that struggle to open your practice to kind of do things the way you want. So that's kind of where how I started going down the path of trying to figure out alternatives to just the regular, insurance system that we were doing, that we're all doing. So.
Yeah, yeah. I love to hear stories, and I love to hear, private practice owners, how they started and where they're going with it. And super excited about this conversation tonight because there are a lot of practice owners out there that are struggling and they
Mhm.
feel like insurance companies are, holding them back.
Yeah.
I look at it from a different perspective, being part of a larger organization. I feel like all insurance companies for me are really just marketing opportunities to get patients in my chair, and it's up to me to provide the right solutions for them to be able to see well. But I
Mhm.
must admit, I am very impressed by everything that you have done, because just looking at your website and learning more about you, to grow a practice to $1 million to see one patient per hour, that is a game changer.
It's pretty awesome.
So, I really want to dive into kind
Mhm.
of the journey of, what you're doing, because clearly there are a lot of our colleagues out there that's not doing what they're supposed to do, because you're being able to sit down and spend more chair time with the patient, earn
Mhm.
money, and probably spend more time with your family simply because you don't have
Absolutely.
to be a slave to that exam lane or insurance companies as
Yeah,
well. So
absolutely.
I'm gonna kind of put the ball in your court. I'd love for you to just, kind of paint the picture of, how were you able to even get to this way of practicing?
Well, I mean, like you said, I really wanted to have a practice so that I could have a good work-life balance. And when you start chasing down insurance payments, and you start thinking like, well, if I might have to hire somebody else to start chasing down insurance payments, I might have to hire a technician to be able to see more patients. But that's not why I opened my practice. I really wanted to be able to have that time. I want to have a small practice that people come in and we remember them. And you can't really do that when you're just spinning through people. And I think patients, I mean, I know patients can see the difference, when you spend more time with them. So I just kind of was looking for a solution. So I thought, why don't I try and see if I can just drop all insurances? I'd rather do that than, if I'm going to be working for somebody, I might as well like go actually work for somebody and not have to worry about the practice ownership struggles. I might as well just try it and see what happens. When it
Yeah.
first started it, and not anybody that I knew at the time was doing it. So I just kind of thought, like, let's give it a try. Let's really train our staff really well. So that's really, I guess, where I started with trying to figure out how to train my staff, how to explain it in a way, because the number one is explaining it, right? I mean, we all do really good exams. We're doing the best we can for patients. But if you go to the front desk and they answer the phone and say, hey, nope, we don't take your insurance, then, without the explanation and getting that patient in the door, then it's just not going to happen. So I think that that's number one, is having a really good staff and team, and, making your team happy so that they enjoy spending that time at the office and also love what they do enough to kind of share that with patients. And I think patients can see that. So,
Yeah.
I came up with like a fee schedule that not based off insurance companies, not based off reimbursements, but what did I think would be fair? Like a patient would call, we'd tell them a price, we'd include certain things, and what would be fair for us to get paid that could support the practice, but also that a patient would say like, hey, okay, that's a fair price for an exam. This is what's included. I'm willing to go outside of my insurance to be able to pay that. And we do file a lot of network for patients. It's a pretty simple process. And so they'll get their insurance money reimbursement back. So they're not feeling like they're completely losing it.
Gotcha.
Yeah. So there's a lot of added value, I think, that we hopefully do for patients that I think they appreciate. So
Gotcha. So from what
yeah.
I'm hearing, it sounds like just proper education and training of your team members in the office, right?
It's number one. Yeah.
Educating on why you're doing this and how to respond to any
Mhm.
patient you call or actually walk in. And then also what I'm hearing is you got to be able to understand your fees, how to understand how to
Mhm.
generate profit in the
Mhm.
practice services, and really honing in on that and standing firm on that is going to
Yeah.
be the key to really get you to the point where you don't have to rely on insurances as
Mhm.
much. Correct?
Mhm.
Gotcha, gotcha.
Yeah.
So when I hear this, I'm wondering, what are you doing in your practice from, professional services standpoint? What are you doing from, as far as what kind of instruments, what kind of services are you
Mhm.
providing to be able to grow the practice and continue to keep the practice afloat? Because,
Right.
um, you know, my patients, they don't want to spend anything unless they have their insurance, right? Now, of
Yeah.
course, I'm able to provide value and say, hey, if this is outside of your benefit, this is why you need that. So I'm able to connect the dots. But I'm
Mhm.
curious to know what kind of services you're providing that's making you stand out to make patients want to come in and spend that hard-earned cash?
Yeah, so we do include screening OCT and fundus photos on all of our patients. And I think having the extra troubleshooting time is really good. And of course, like we'll do no charge RX checks when they come up. But, really, I think having our prices listed, having everything is included listed, and then I will add that value in. So for the most part, I work up most of my patients. If I'm running behind, they'll kind of start them. But for the most part, I think going through the whole history, explaining everything to patients, knowing that, I kind of talk through while we're talk through like what their problems are and what we can improve, like while we're going through everything. And I think that adds the value. But also when I've been doing the scans, I do an OCT and a fundus photo every year. So I just pull up all the previous ones and I say, look, we've been doing these for the last 6 years. See how we can see really carefully if there's any changes. We can help detect early signs of eye disease. And sometimes I'll even pull up a picture of like diabetic retinopathy and compare it to others and show them. And then they can I feel like that just adds the value. So when they've got that, the comparison and that visual there, that it adds a lot. And I'm not having to ask them to pay for it. It's already included. So
Right.
It's already included. And it's nice to have anyway for us. So now I've got that already included, not having to be like, well, it'll be $40 for this and $40 for that. I mean, we don't want to do that in the exam room. I feel like, we want to be able to get the testing that we want, not feeling like we're having to say like, well, it'd be good for your eyes, but it's going to be an extra $80 for you, so.
Yeah. So I'm just curious, I'm still trying to wrap my brain around this because this is phenomenal. I mean, to be able to just, jump in and not have to worry too much about the financial aspect, to me, it's just mind blowing. I know over time you have created what we call direct care difference, and I'm assuming this was created due to what you've done in the exam lane and being able to build that $1 million practice seeing one patient per hour. So I would love to kind of step away from that exam lane, that conversation of seeing patients and what takes place, to really how this organization or this business has changed the way that eye care looks. So could you give me kind of an overview of what that business is, and maybe we can dive into the guts of it? If there are any pillars, maybe we can peel that back and learn a little bit more about that organization.
Absolutely. So, well, it's really just me. I put together I guess it kind of stemmed in during COVID. We're at home looking on the internet, and all you see is like fears about what's going to happen, what our insurance, like how are we going to be able to survive on these insurance reimbursements? We don't get enough insurance reimbursements that we're able to build up. It's just without the patients, it's not there. And I just kept seeing so much unrest. And I thought, I've been doing this it was 3 years at that point. Why don't I know how to do it. Why don't I tell people how to do it? And then hopefully it will improve people's lives and not just, doctors, of course. Yeah. But also their patients, because they're able to have that time to troubleshoot. It just creates we have a really nice kind of family feel at my office. And I think that a lot of patients really like that. And, I think doctors like that too. It's just, how do we know how to get to that system there? So, and I think it really is financially viable for people. I did step into it not really knowing what was going to happen. But I did know that, say our reimbursement is, $40 or $50 or something like that. Even if you charge like $100, $120 for an exam, you can include those testing, which you would be trying to sell to the patient anyway. And then you could cut your patient base by 2/3 and still make the same amount of money. So you can extend your exam times. Even if you say you took a 20-minute exam and extended it for 30 minutes and cut your exams, you would still make more money. And because I think what a lot of people don't realize, two things really, is that when you've got that extra time, you add that value in and you can make specific recommendations, which really translate better into optical sales. Because in our optical, we have very good sales, but we sell good quality products, which I think is important. But we don't have the most expensive products ever. We're not trying to be the most expensive. We're not trying to be super boutique-y. There's a place for that, but that's not just what we are. We are more of we are accessible to everybody to provide good care. So I really think that what most people don't realize is that it is possible to cut your patients by a lot and still make more money. So
I love it. And from what I'm hearing, you're providing quality services, but it sounds like you're getting an incredible price when it comes to cost of goods. And as a
Absolutely.
result of being able to price things properly, that
Mhm.
margin is pretty nice. And as a result of that, you're cutting down the patient time, you're getting that work-life balance, and
Yeah.
you're changing the game, not just for your patients, but also for your team members as well. I
Yeah.
can only imagine that, in your office, your team members are super happy because they're not being stretched from,
Mhm.
over here to over there, worried
Yeah.
about cross training too much, simply
Yeah.
because you actually have more time to sit down with those patients and build that relationship and
Yeah.
grow that loyalty over time with that patient in front of them as
Absolutely.
well.
Yeah, absolutely. And, I think our patients can really see that too. I mean, people tell me all the time, like they can just sense a different vibe when they come into the office. And I appreciate that. I tell them, I really try to be a little different. So I appreciate when people notice that, and they do. So, but yeah, I mean, when you're not spending forever on the phone, chasing down insurance reimbursements, or just spending so much time explaining how sorry the benefits are, because nobody wants to tell people how pitiful the benefits are or what they're, so what we just tell people is, look, it's going to be this price. This is what you get. We're happy. We're there for you for whatever you need. And, I think that people really see the value. Now, the people that don't see the value might go somewhere else, but they're not really the people who were making your life happier anyway, right? They were the people who you were on the phone with insurances for a long time anyway. So I feel like you really get the patients who value your services, and that just creates even more of that better work-life balance for doctors. So.
Do you feel like the patient journey is any different from if you were in a corporate entity versus more independent or private practice with this way of more cash versus insurance, or is the journey pretty much the same, but you're just spending more time with the patients?
I mean, I guess I feel like the insurance companies kind of drive patients to corporate. There's a big push to that. So I feel like if we don't do something to separate ourselves, then we're just trying to see people faster, like corporate, and we're not really separating ourselves. We have to do something different to separate ourselves, and you can't really do that and still be profitable, I don't think. In private practice, you want people to come to private practice. You don't want to feel like you're competing, because no, you don't want to open your own practice to work like a corporate setting. But if you don't, it's very hard to be competitive that way. And so I think this is a way for us to be competitive in private practice, give good patient care, have that good work-life balance, and not feel like we're trying to compete with corporate. It helps us continue to be more independent and really keep optometry independent, I think. So.
I love it. I love it. So kind of talk to me about, again, differentiating yourself from some of these other big practices, these big boxes out there. I know
Mhm.
you kind of walked me through the journey, but I know you also have a love for dry eye. And I'm
Yes.
curious to
Yeah.
know, how this complements what you're already doing with not accepting insurance, or are you accepting insurance when it comes to medical optometry, or is it just all cash all around for the most part?
Yeah, it's all cash all around. So I think that our prices are fair for our dry eye treatments that we do. We do try to overall have a little bit lower prices across the board, because when everybody pays those lower prices, then overall the profit is more. Yeah, we have an IPL, and we do a lot of kind of natural dry eye treatments. I think a lot of our patient base, just like everyone's, is on the computer all the time. We see a lot of dry eye, and I think you're in Raleigh, the area that we're in, people want to have not just medical. They want to know that we're thinking about lifestyle and having other kind of recommendations that aren't just like, here's some drops, we'll see you later. You're going to take them for the rest of your life. So really, I think that's been huge to be able to incorporate, and all of it. Everything that we're doing is really just trying to improve our patients' lifestyle, help them in ways that we can, that they're asking of us and that they deserve. So.
Wow. So cash all around. So kind of walk me through what a day in a life looks like for Dr. Foster, right? You tell me one patient an hour, possibly. Kind of walk me through when you walk into that practice. How many true patients are you seeing in an hour? Is it truly
Mhm.
one, or some
Mhm.
days is it a little bit more? And how many hours are you working, and how many days a week are you working? So we can kind of paint the picture of what this looks like
Yeah.
from the physician standpoint.
Absolutely. Well, I come in at about 9:25 because I like to get my daughter on the bus. So I get my daughter on the bus, and then I come in. Usually the patient's there for just a couple minutes before we book at the first patient at 9:15. So they'll take the photo. They'll get them checked in, take the photos. But I really don't like to keep anybody waiting long. So that is the longest anybody is there, and they'll kind of fill in for the first patient with me. And then, I mean, really, it doesn't take me a full hour. So my team is very good at knowing who will take me longer. And once in a while, it gets off. So, we might put, not in that first slot, but like maybe at 10:45, we might put a follow-up in at that slot.
Okay.
So not always, but, if we needed some time for a follow-up, we'll put them in at that 10:45 slot. For kids, I mean, we put them in 30-minute slots, and it still doesn't take me that long. So, I mean, I still have time to like go out there and chat and optical for a few minutes and not feel like I'm just running to the next room. I walk every patient out to optical and kind of go through that whole process of, here's what we talked about in the exam room. And I will print out their prescription. I actually have printers in my exam rooms. I don't want them to feel like I'm withholding their prescription. So I print out the prescription, I write my recommendations on the prescription, I hold it up for them, and I'm like, here's what we talked about in the exam. Here's what I would recommend for you. And I'll be like, let's head over to optical if you have any questions, so-and-so can finish up with you and answer any questions you might have. So we don't want them to feel like pushed in going into optical, but it just kind of a good flow. So yeah, I mean, I will sometimes, depending on the patient, see, but if it's a new patient, multifocal contact lens wearer, I mean, we'll book them for the full hour, so that yeah. So, but then, established patients I can usually do in 45 minutes and still be done before that. So it depends. Some people are talkers. They know that I'll talk and spend that time with them. So, but I like it. I feel like I get to know people, and really, I like to ask people about their vacation plans. That's one of my big things, my talking points. So like now, all I want to do is travel. I have all these like great ideas. People give me like such great ideas for travel.
Yeah. No, I love it. And how many days a week are we working roughly? Are we doing 5 days, 6 days? What does that typically look like?
Our whole office closes at 1:30 on Fridays. So we're just 9 to 5 most days. On Mondays, we stay till 6. But like I said, it's pretty straightforward. We just want to be like kind of accommodating. We're never open on the weekends. We close at 1:30, and nobody cares. Like nobody is bothered by the fact that we close at 1:30. Where I feel on Fridays and on our open weekends, I feel like we've got this like drive with corporate that we feel like we have to be there all the time. But that's so draining and takes so much time away from the family. And patients see us as family people too, and I think they appreciate that we want to spend that time. So. But yeah, I mean, I only work like 4.5 days a week, and sometimes I won't even work Fridays. So,
Gotcha.
Yeah.
Nice. Very nice. And kind of paint the picture of what your practice looks like, because what I'm looking at, or what I'm trying to get at, is there's someone out there that's looking to make that jump to just cash only and do it with insurances. And they're looking at you, Dr. Foster, and they're like, I think I might be able to do this now.
You can do it. Yeah.
And they understand what the patient journey looks like. They understand what your daily hustle looks like from your perspective. But they may be thinking, do I have the right practice for this? Is my practice too big? Is it too small? What's a good starting point? So I'm curious to know, how many square feet is your practice? How many team members do you have working your practice? What does that look like in its entirety?
Well, I mean, I would say I think it's possible to do with the bigger practice. I started when my practice was still pretty new, and then I've actually kind of tried to keep it intentionally a little smaller. Okay. I don't want to get too big. I've looked a few times at getting a bigger office space, but I don't want the pressure to fill that up and see more patients and make it busier. I appreciate this. I think we're doing really well. So I appreciate that we can be $1 million practice with 2 exam lanes and 1,400 square foot office. So it's not very big. We probably have about 500 frames in our optical, maybe a little bit more. I should have checked that. We've just been increasing a little bit. We try to have only independent lines. We work with really good quality lenses. Our labs that we work with really help support independent more than I think what we're led to believe. So we can get some pretty good help on our cost of goods. But really just kind of got rambly there, but I think just it just really helps to keep it small almost, but it's possible to you can make your practice, you can make it a little bit smaller. You can drop one insurance at a time. But I think the number one thing is explaining it well to patients, including that value, and then showing up when they get here. They can't walk in and then you've spent all this time explaining, and then the front desk person talks to somebody else, talks to optical for 15 minutes before they make eye contact with them. Like, you have to address them right away. Like, I like it. I tell people when they're coming to work with our office, that it feels like when a patient comes to the office here, like it feels like somebody coming to my house. I wouldn't just not acknowledge them for walking in the door. We have a little refrigerator. We offer them drinks while they're waiting, and just we'll chat with them. We don't just let them sit there, and we make them feel like they're guests who are welcome. Back to your point about how many employees I have a front desk, I have a full-time optical, and I have an office manager who also does who also will do optical as well. So my optician can take a day off. But I think we all really spend more time and have a kind of a thought process that we like to explain to patients, so I also have a part-time doctor who will let me take vacations every once in a while now. So yeah. So she works a day and a half a week, which is awesome too. She does a really great job, and it's hard to find the kind of doctor who would fit in well at a practice like this. And I'm really fortunate to have her. So.
No, this is all fantastic. I mean, when you look online and you look at all these forums, you see all the ODs out there in the world saying, I do not want to accept an insurance implants. I'm done with them. They're killing my practice, this, that, and the third. Again, I have a different perspective. I feel like it's grown my practice and I'm thankful for it. But we all have different ways that we like to practice. And again, I feel like this conversation is opening up the dialogue for those colleagues out there that may want to make that jump like you did. Yeah. And I'm just grateful that you were able to have an authentic, a real conversation and kind of walk us through what that direct care process looks like, because we got to be able to cater to our patients, and patients like patient care in all different size, shapes, ways, types. And if we're not able to provide what they need, we're not going to be able to provide that direct care. And most importantly, to your point, we're not going to be able to improve the healthcare system. So this is fantastic. Fantastic. So if you had to give 3 tips for someone out there that's listening to this that want to kick this off and kind of do away with insurance, what would be those top 3 tips before we close out this evening?
Let's see, top 3 tips. I would say first, come up with a plan for your fee schedule. Then find out what local insurance reimbursements are, so that if patients call, you can say, hey, this is how much it's going to be. This is what's included. And then you can tell them you should get about $45, $50 back from your insurance. And so that kind of puts it all together for them. They still feel like they know that they're going to be using their insurance. And then also just getting your staff ready to keep the conversation positive. That is the number one thing. I should have put that as first, but that's the most important thing. You got to keep it positive. If you just say, no, we don't take your insurance right away, then that's all they hear. You have to start off explaining it in a way that as adding the value to the patient. And I think once you can do that and go through some team training, that's huge. So.
I love it. Now, one thing I like to ask all my guests, especially my rock stars like yourself, is when it's your time to retire that phoropter, what is the legacy that you want to leave behind? What do you want to be known for? Because you've done a lot of great things in the doctor-patient space when it comes to dry eye. What do you want to be known for, Dr. Foster?
Wow. Well, I guess I want to be known, I suppose, I enjoy being a trailblazer. I like kind of setting the stage for optometry to grow in more of an independent way. I want to be able to teach ODs how to do this. I really think it would be fantastic for private practice optometry. So I want to be known for that. But also I have 3 girls in my house, and I want to be able to show that for women in optometry that you don't have to be, you can practice a little bit differently. There's a different way of practicing. They can create like a great work-life balance. You can bring your kids to the office. My 10-year-old comes and works here. I'm teaching how to do contact lenses. I want to be able to show that it is possible for women in optometry to be practice owners and to do things a little bit differently. Sometimes we think a little differently, and I think that it's fun to, show, so really, I also set a good example for the girls in my life too. So
I love it. Well, you're making an impact. I greatly appreciate everything that you're doing. Continue the fantastic work. For all the listeners, all the followers, everyone that's tapped in and will tune in at a later date, if they're interested in learning more, getting some consulting from you with direct care, what's the best way for them to contact you or take advantage of the resources that you provide?
Okay. So I do have a website called directcaredifference.com that has a lot of information on that and a training training program. They can also reach me at my email at drkara@directcaredifference.com. I'm also fine with people texting me with questions. My cell phone number is 919-428-4390. Text is usually easier than calls. And I also just put out a comprehensive guidebook on Amazon that really takes a lot of the information that I put together in my training program and just puts it all into a guidebook. So kind of excited to be able to put that together. So that's also something to look up. But like I said, I'm happy to answer questions. If somebody wants to go down the route of direct care, I highly encourage it. And I would love to be there to support in any way, because it's, like I said, it's just a great way to practice. So, and I really appreciate you giving me this opportunity to talk about it and to just kind of go through everything, because like I said, it's great. So
yeah, no, I mean, that's what Defocus Media is here for. Dr. Jennifer Lyerly and I created this platform to create authentic dialogue about what's going on in healthcare, but in particular eye care. So we're all about amplifying the voice of independent optometry, corporate optometry, private practice, whatever you want to call it. We just want everyone to understand that there's a route for you, and we want to provide the most clarity to whatever topic or conversation that may be out there.
yeah.
So I want to just say thank you. And I also want to just read out, some of these quotes, or at least one of them, in regards to some folks that you've partnered with. I mean, we have one of these quotes here, or testimonies, talking about meaningful relationship as a family physician. I love that direct care model of practice, meaningful relationships with the insurance companies. I mean, the list goes on and on. But you're doing some incredible things. But continue the great work. For all my colleagues out there, tap in with Dr. Foster. I know you want to increase that bottom line. And when it's all cash to the bottom line, that changes the game for you. It's no doubt about it. But most importantly, the key thing that she has focused on, and what we started off this conversation with, was how can we improve the healthcare system?
Absolutely.
How can we build that doctor-patient relationship? How can we master that patient journey? There is a way to do this. And if you tap in with Dr. Foster, she'll make that magic happen for you. Yeah. Thank you, everyone, for tuning in. It's your favorite optometrist, Dr. Darryl Glover. Stay healthy, stay positive, and stay blessed. And until next time, peace. Hey, family, if you enjoyed this full podcast, don't miss out on more engaging content. Check out the next episode right here. And for the latest updates, hit that subscribe button and ring the notification bell. Your support means the world to us. Catch us in the next episode. Peace.